Could trauma be the hidden reason behind why a child's nervous system won't settle? Well, emotional dysregulation is often the first clue. So, what is emotional dysregulation? It's a nervous system that can't return to baseline after stress, whether it's real or perceived. Emotions become too big for the moment, don't resolve quickly. Some of the common signs you see are intense mood swings, shutdowns, refusing to do things maybe they did or didn't do before, emotional withdrawal, aggression, defiance, panic, and it's often mistaken for defiance, immaturity, or a bad attitude. And when we have trauma, if it's a newer trauma, we always want to be especially concerned if these behaviors are new, right? Because it could be a sign that there's a traumatic event. It could be a sign that there's infections and toxins activating our nervous system. Sudden onset of behaviors in kids are not normal, and something is driving it. Should never ignore it. If your pediatrician says, oh, they'll outgrow it, or some other provider, go and find a new one, because every parent I know who doesn't ignore their parent gut is the one that gets their kids the right help. So let's talk about how trauma affects the brain, what types of trauma, what are they? How do they lead to dysregulation? And what are some of those signs that are trauma based dysregulation? Of course, as always, what helps. So trauma affects the brain. Um, in many ways. But what happens is our amygdala, our stress center, becomes hyperactive, and your brain will interpret small challenges or changes as threats. It triggers that fight, flight, or freeze or fawn response in an individual or child. And it can look very different in kids, right? Because they are nothing but behaviors. And the more young they are, the more extreme sometimes these behaviors can be, because older kids who've experienced trauma, you're much more likely to see some of that fawn or that freeze behavior. But again, there's no rule book for this. How the body holds trauma and how that nervous system and brain are going to react are unique to each person. And the more trauma you have, the more likely you are to have traumatic responses to potentially what we call small traumas or big traumas. It's harder to recover. So let's go back to the brain. So our prefrontal cortex, right, disconnects. And that is a primitive reflex that's left over so you can take action when you move into fight, flight, or freeze. So that means your child is losing access to logic, language, and the ability to emotionally regulate. They can't outthink their way out of their body's response, right? They can be taught to with therapy and some of the things we're talking about. Your hippocampus or your memory center becomes less reliable because you're so dysregulated. So that's going to affect your learning, your recall, and emotional associations because you're looking at it, right, in such a highly dysregulated state. That's why they often say, back in the old days before DNA, that you couldn't rely on witness testimony. And that was because people were so emotionally activated, right? So your neurotransmitters aren't going to work correctly. Your cortisol, your adrenaline is going to flood your system and dysregulate everything. And that's going to keep people stuck in a reactivity loop. And then what's the result? The brain and the body is stuck in a chronic stress response until you find a way out of it, right? So, what types of trauma are there? How do they lead to dysregulation? So, we call big T traumas, things that are like, abuse of all kinds, big accidents, big medical emergencies, extremes, right? Car accidents, surviving something horrific, or again, those types of abuse. Little t can be anything from bullying, which to me also can be a big T, frequent transitions, moving all the time, emotionally unsafe environments, the loss of a pet, the loss of a grandparent, even medical trauma. Most of my PN's families have medical trauma. Developmental trauma is different. It is when there is early trauma and it's repeated. And what happens is there's a lack of emotional attunement due to these repeated stressors. A child has a right to be born in a family that's gonna love and care for them, and when they cry, they get picked up, and so when kids are abused or, neglected, it creates, a difficulty within the nervous system, we call that developmental trauma, and, even when you're doing the best that you can, kids can have traumas happen to them, and the more we support them, the better they are in overcoming this and being able to safely put this in a compartment within their brain so it doesn't activate them all the time. There are healthy ways to deal with trauma. And really, when it gets down to it, you have to be taught how to safely talk about it without reactivation and put it away in a place. And therapists can really do an amazing job. I, again, have helped so many people do that. I feel really good. But when your kid is reactive and, struggling, it's not always attention seeking, it's protection, and their nervous system is doing exactly what it's supposed to do to survive. And I know that sounds confusing to people, but once you move into that primitive state of fight, flight, freeze, or fawn, then it's doing what it's supposed to do. It's not supposed to be there all the time, and we can unwind that. So what are some signs of trauma-based dysregulation? So there's so much overlap in some of the behaviors, but there are some differences in what you see when somebody's had trauma. You see a lot more we call hypervigilance, really stuck on things, but also their nervous system on edge, jumpy, trying to control their environment because things feel so chaotic. You see that same sensory sensitivity, which can be confusing because it can cross over into many things. And this can be even more confusing when you already have a kid who's neurodivergent and they've experienced some type of trauma, right? Because each one, can amplify the others. You can see sudden perfectionism or fear of making mistakes, difficulty with change and transitions, aggression followed by guilt and shame, and then disconnection or refusal to engage when overwhelmed, or even disconnection from things they used to enjoy. You really want to be concerned because then obviously not only do we have the trauma, but you can start layering in, depression, suicidal ideation, which is very common, right? Use of substances. So what helps when somebody has had experienced a traumatic event or developmental trauma, right? So safety first, predictable, calm environments is gonna tell the nervous system you are safe, right? Co-regulation, whether it's in the classroom or in a daycare or at home, calm adult presence leads to regulation. You become that emotional thermometer where your child is, or a child is picking up on all those important cues to regulate. I'm a huge fan of somatic work, and somatic work is teaching your body to pay attention to the signals and regulate. And you can do that through breath work, sensory activities. There's actually a full therapy called somatic therapy where you are understanding what your body is telling you instead of reacting to it. You're using that as a clue that you need to regulate. I'm working with a young woman who has some trauma in her background. I'm teaching her this, and she's looking for the magic wand, but that's just not what happens. You got to do it every day to create safety, right? And reduce that, what I like to say, that up and down reactions. And then we start getting, you reduce the intensity, frequency, and duration of this dysregulation, right? Of course, trauma informed therapy is a non negotiable. Regular therapy with a therapist who isn't trained in trauma is essentially a waste of time. And there are things like EFT tapping, EMDR, neurofeedback, somatic therapy. You really want to go to somebody who knows what they're doing in terms of trauma because you just move through it quicker. And when you go to traditional talk therapy, what happens is you activate and you don't have anywhere to put that trauma. And so then a child or an adult says, "Well, I went to a therapist and all I did was walk out of there feeling like poo." That's because they weren't trauma informed. And I'm not to say that trauma informed therapy isn't a bit tough either, but there's tools that help you to regulate your body because that's important. And just know that daily regulation practices with your child for yourself before, after, during emotional upsets are essential. And these are tools that will serve you forever. And I want you to integrate these tools into your daily life, just like brushing your teeth, because we brush our teeth to prevent cavities. When you use regulation tools on the daily, you're preventing dysregulation, no matter what the source is. It's just this is a big one. So, it doesn't matter. Trauma may not seem obvious to parents, but again, if you're seeing a sudden onset or right, that there was a trauma, don't ignore it. Emotional dysregulation is a sign of a dysregulated nervous system, and trauma could be part of that. And, healing is really going to start with that emotional safety and regulation. And, it is absolutely possible. I've seen so many people heal from trauma, no matter what kind of trauma. And if you're looking for more support, you can go to our solution matcher. You can go to drroseann.com/help, and it's going to guide you to what you need. And again, more importantly, you're going to get resources to remind you to do these things every day.